Cavernous sinus structure and function. Structure. The cavernous sinus is a complex network of veins located on either side of the sella turcica, the bony saddle-shaped structure that houses the pituitary gland. It's divided into compartments by trabeculae, giving it a cavernous appearance. Key components of the cavernous sinus include veins, arteries, and cranial nerves. Veins. It's a primary drainage area for blood from the brain, eyes, and face. Arteries. The internal carotid artery passes through the sinus. Cranial nerves. Several cranial nerves, specifically 3, IV, V1, V2, and VI, traverse the sinus on their way to their respective targets. Function. Venous drainage. The cavernous sinus plays a crucial role in draining deoxygenated blood from the brain, eyes, and face. It connects to other venous sinuses, ultimately leading to the internal jugular vein. Pathway for arteries and nerves. The internal carotid artery passes through the sinus, supplying oxygenated blood to the brain. Additionally, several cranial nerves that control eye movement, sensation, and other functions pass through the sinus. Clinical significance. Due to its complex anatomy and the vital structures it contains, the cavernous sinus is a critical area in terms of clinical significance. Conditions affecting this region can have severe consequences. Cavernous sinus thrombosis. A blood clot in the sinus can be life-threatening. It can cause symptoms like headache, eye pain, vision problems, and neurological deficits. Infections. The sinus can be a pathway for infections to spread to the brain. Tumors. Tumors in the region can compress the structures within the sinus, leading to various neurological symptoms. Understanding the structure and function of the cavernous sinus is essential for medical professionals, especially neurosurgeons and ophthalmologists. Would you like to learn more about a specific aspect of the cavernous sinus, such as cavernous sinus thrombosis or the cranial nerves that pass through it?